Hi, I'm Bob Batcher, Executive Director of Prime Plus Senior Centers, and this is Prime Time with Bob. And I'm with some brand new friends that, thanks to technology, I met a few weeks ago. I was in one of those Zoom meetings with making a presentation about Prime Plus, and I didn't know who I was talking to. I couldn't see them because they were behind black boxes with their names on them. But I discovered they're really cool people. And it's Carla Thomas and Cindy Warriner. How you doing?
Hi,
And you
Doing
are with,
great.
we work for Health Quality Innovators.
so that's what HQI stands for?
Yes,
Cool. And you were meeting, Carla, you were presenting to a group of healthcare providers that when I go through Google, I see them as maybe competitors. Now, as the executive director of Prime Plus, I'm learning that the world really works well together when we open it up, right? So
absolutely.
who are we meeting with?
When you were presenting to that group in your local area, that was the Hampton Roads Care Transitions Coalition. And that's a group of hospitals and local organizations and other care providers that are working together to make sure that any patients that transfer from one location to another, like the hospital to a nursing home to home, don't have to return back to the hospital unnecessarily.
So there's a common goal there, right?
They're trying to make sure that they coordinate and communicate so that care is better for the patients they serve.
Because it just, from the consumer point of view, it just seems like it's gotten so complicated, and we're going to talk about that in the next few minutes, right? So,
Right.
So what role do you guys play then? Because you're calling in from, where are you?
Well, Cindy and I are both based in Richmond, and we are healthcare improvement consultants. Health Quality Innovators is a consulting organization based in Richmond, but we are very well known for our work with Medicare. And Medicare contracts with us to organize and facilitate quality improvement projects with Medicare providers and local community partners, such as that coalition that you were presenting to.
Okay.
So it's all about making care better and more coordinated and more affordable for Medicare beneficiaries.
Okay, because I was home yesterday when my mail came. I had a small envelope. My wife had a big envelope. It was an EOB from Medicare, and it was ABCDs and all this stuff. But it all makes sense now because they are working together to make sure I'm healthy.
Absolutely. There are many initiatives that Medicare sponsors and contracts with people, with organizations to facilitate in the local area to make sure that the care is as best as it can be for each beneficiary.
Carla, when you and I did the old-fashioned way and picked up the phone and talked to each other, you mentioned something that really got me excited because I know what day of the week it is by going to my pill box and taking the pills the doctor prescribed to me. And I got screwed up one day because I got a new prescription. It went from pink to green. I didn't know what I was doing, but I did what I was supposed to do. And you said that's a huge concern of you all, and you brought us an expert to the box.
Absolutely. Well, one of the initiatives that we really focus on in our work with Medicare and with Medicare providers and organizations and partners in the community is patient safety. Mm-hmm. And a big topic within patient safety is medication safety. Safe medication use, understanding medications, making sure that they are current, and that's Cindy's area of expertise as a longtime pharmacist on our team. And we are conducting a number of initiatives to make sure that patients don't experience what we call an adverse drug event. And that a lot can happen when drugs aren't taken properly.
I was gonna say that's code for things going south on you.
Things going south, yes. So Cindy, you can share much more about safe medication use and some of the questions Bob might have.
Yeah. Hi, Cindy.
Hi, guys. Nice to be here.
So you're not in your white lab thing, so you're a pharmacist though, right? By training?
Absolutely. I have been a pharmacist for over 34 years and have worked in Virginia in the community setting mostly, but obviously partnered with different groups and pharmacists in the community at your either your independent pharmacy or your community pharmacy, work together with hospital pharmacists, long-term care pharmacists to try to ensure that patients have the key phrase that I would love for everybody to remember is the right medication at the right dose at the right time. And that can be tricky.
Well, I made the comment about going from green to pink or pink to green, whatever it was. If that happens, what should I have really done instead of what I did do?
Actually, anything that you receive as a prescription, or I want to put a little disclaimer in here, over-the-counter medicines are just as important and or dangerous as prescription medicines. But anytime there's a change, to me, the first thing a patient should do would be call their pharmacist and ask them, the color's different. I just want to make sure this is the same medicine. Sometimes the colors can change and it's the exact same medicine.
Mm-hmm.
Sometimes the colors can change and it's not the same medicine and you don't want to take that. I mean, patients, Medicare recipients are an important piece of being engaged in taking their medicine. I think it's important to understand that.
Because I come home from the doctor's office, my wife always has that one question I forgot to ask. Or I go there and I'm in total trust. He tells me to take these pills, I'm going to take them. So if I call the pharmacist and say, hey, this is pink instead of green, I'm kind of offending him, aren't I? Because
absolutely not. Absolutely not. And I think you'll find pharmacists, and in fact, that would be probably one of the best pieces of advice I could give someone. Find a pharmacist that matches up with you. Okay. And try to have that person, just like we have a new budding relationship, and Bob, you have a relationship with your listeners. It's so important for the patient to have a relationship with a pharmacist, especially with how complicated everything's gotten today. You have your general practitioner, you have your specialist, you have, if you were in the hospital, you have your internist, and all those computer systems don't always match up. And so it's important for there to be, especially with medicines, kind of the medication expert. I just think that in itself, and I've told plenty of patients before, if I'm not a good match for you, find somebody that is. And then try to stick with that same person. And I know insurances sometimes say you have to do mail order or you have to go to this store, but you still need to find a pharmacist that knows you as a person.
Now I've gotten, being 67, I'm getting kind of used to going to the doctor now. Sometimes it's over this mechanism instead of going face to face, or hip surgeries or elbows, things like that. So my wife got out of the hospital with a procedure and there was a pain med that she was issued, but she already had some left over from previous surgery because there was more left. That kind of self-medication, and that's common for us to do because waste not, want not, right?
Absolutely, but it can also, in some instances, even be fatal. So I think it's really important. Oh, yeah. When you are given a new prescription and you think, oh, this kind of looks like the same stuff as the old prescription, and I've already paid for that, and it's been in my medicine cabinet for, let's say maybe 3 years. First off, it could be expired. And some things do decompose into something that can be harmful. Secondly, even if it looks like the same, it might not be the same.
Okay.
And I've even had instances where I've told some of my patients, please don't keep this stuff. And they still don't want to throw it away. So they even give it to a friend at church. So
well, they got stimulus, yeah.
And in the best intentions, trying to help people, you could actually be harming them. So I think it's, if you do have something, once again, and it looks like the same, you'll hear a reoccurring theme from me: call and ask your pharmacist. They would be able to tell you, it is the same, but look, Bob, it's a different dose. We need to adjust it this way. Or, okay, it's only 3 months old. Maybe we can figure out a way to use it, but I'm going to need to call your doctor and check on it. So there are those kind of processes. But see, Bob, I wouldn't know that you have that need if you didn't call and ask me.
Well, I've learned to Google, though.
Well, I will say Google is Google. You aren't always getting the expert advice. I think with medicines, anything that's chemical that you're putting in or on your body, it's really important to have that real-time discussion, because you don't know who's behind that Google scene. And if there is a situation or a problem, you want to be able to go to somebody directly and get some help.
Right.
Cindy, can't your pharmacist can also help you understand drug interactions and look at the combination of medications
Absolutely.
that you're taking?
And I think that's the biggest thing, especially for those of us, Bob, I just turned 60 this year.
Oh.
So I will say aging is not for chickens.
No.
But I think especially with the complexity of the healthcare system and all the different tugs on us, whether it be virtual or different physicians, with your medicines, to have a safe medication review, and most pharmacists are able to do that. Now, let me just give a little disclaimer. If you show up to a pharmacy between 4 to 6 p.m. on a Monday, that's really a busy time. I would call and say, can we set up an appointment? Can I bring in my meds? Would you please go over them with me? Because I'm not sure exactly why I'm still taking this that was prescribed 10 years ago, and I've just changed to a new primary care, and I told him I had it, but I'm not sure he really listened. You know, because there are other things, because I had a swollen toe or something.
Right.
So I think it's important at the very minimum to have your list of medications reviewed by the drug expert, the medication expert.
And it's okay to bring along a friend or someone who's acting as your caregiver too.
Absolutely.
Yeah.
Absolutely. I think for there to be an understanding, it used to be, well, I'm going to date myself. When I graduated from pharmacy school, the average senior citizen or Medicare patient or person over 60 was maybe on 3 to 5 medications. Today, it is not unusual to see someone on 10 to 15. I had some patients that were, the highest was 32. And clearly they didn't need to be on all of those things, but it was the best intentions of multiple prescribers trying to help that patient without having the whole picture.
We're almost going to be running out of time, but I got one more thing, because you said over the counter, but how about those infamous supplements? It's just vitamin D.
No, supplements, eye drops, ointments and creams, vitamins, minerals, all of those can interact. And I guess, Bob, the biggest message I would love your listeners to hear, and you know what, if you guys like this and you're going to do something about it, please hit the like button so that I know. That means a lot to me, that I made a difference. But it's your body, it's your decision, and you play a key role in this. So pull your team together, and my advice would be make sure you have a pharmacist on your team.
Good stuff. Because I think so often we kind of let our old upbringing interfere. You know, oh, I don't really need it. I won't take it. I'm feeling better. I don't need it. I'll save it for later. The ones I always get, so I forget to take my pills at night. So I always end up with more of them at the end of the prescription. And so take that stuff seriously. Now, we had about a minute left.
Okay.
So I want to talk, this is the beginning of a new relationship for Prime Plus. I really want to stay in touch with you guys and allow our members to be in touch with you all. So will you provide us some information that we can kind of share with our members and with people watching this?
Absolutely. In fact, we'll send you, Bob, some resources that can be shared, but also a way to contact us if you have any question. My closing comment is, listeners, you guys are the key to who's going to be a part of your healthcare team. And medication can do so much good for you, but it can also hurt you. So just make sure you have a team pulled together, that you're getting expert advice. Pharmacists focus solely on medications and how they interact with the body and what it does to your overall health. So you would want to have a relationship with one. And if you have a problem finding it, you let Bob know, and I will be happy to help.
And hit that like button when you're
Yes.
done watching, and share this around. Carla and Cindy, I am so excited that you guys are now in my world. And I'm planning on taking your stuff and sharing it with the rest of my world.
Well, thank you so much for the opportunity to talk with you today. We are excited about partnering with you so that you can share more information with those that you serve and support, so that everyone could stay healthy. Cool. And live a great life.
Thank you. And keep in mind, stay safe and stay connected. Thanks a lot, guys.
Absolutely.